Hi, I'm Dr. Lauren Zimski. I'm a board-certified ophthalmologist. I specialize in dry eye and ocular surface disease. When I see a patient for the first time, I often hear similar stories. They've seen multiple eye doctors, they've tried different treatments, but nothing has worked. And more importantly, no one has explained what's actually wrong with their eyes or given them a diagnosis. When patients come to see me, it's different, especially the first time I see them. I take time to look carefully. I take pictures. I show them what I'm seeing. I explain what's causing their symptoms, and we create a comprehensive treatment plan. And then many patients ask, why has no one ever explained this before? Or why hasn't anyone treated my eyes this way? And they feel frustrated, which is understandable. A little background about me. I started practicing ophthalmology in 2007. At that time, dry eye care looked very different. There was really one FDA-approved treatment, and that was Restasis, and it wasn't great. In clinical trials, it did increase tear production, but in reality, patients often didn't see that benefit because it took about 6 months for that to happen, and that's a really long time. Most patients never stayed on it long enough to see that benefit. So I told them to use artificial tears, and if that didn't work, I offered punctal plugs. For a long time, both doctors and patients were limited, not because it didn't matter, but because we didn't yet have good ways to treat it. Around that same time, I developed some serious health issues of my own. I didn't feel well. My blood work was abnormal, and I started to see a lot of doctors, but no one had a diagnosis. But even worse, many of them blew off my concerns. And over time, that created a real sense of feeling dismissed. And I started to wonder, maybe this is all in my head. But I pushed back because ultimately I knew there was something wrong. I just didn't know what it was, and I didn't know if it was fixable. After about 1.5 years, which felt like a really long time, I finally found the right doctor. I got a diagnosis, which was an uncommon autoimmune disease. I started treatment, and then I got better. I didn't get better immediately. It took time. It wasn't overnight. But I felt better, both physically and emotionally, because I finally had a diagnosis and a plan. And most importantly of all, I had hope. That experience really changed how I practice medicine. It taught me how damaging it is to be told nothing is wrong when you know something is, and how powerful it is to finally feel heard. At that same time, dry eye care was evolving too. There were more treatments, there were better tools, and there was lots of research. I knew I didn't want to be the doctor who told patients to use artificial tears and send them on their way, because now we had better options, especially as I saw more patients, including younger patients struggling with dry eye. I wanted to help my patients the way I had finally been helped. So I started learning. I spoke with colleagues. I attended conferences, I invested in effective technologies, and I continue to stay current as new therapies emerge. Today, I spend significant time with my patients, especially during the initial evaluation, because dry eye isn't simple, and many of my patients have lost hope. And it isn't one disease. It's a chronic condition that affects the entire surface of the eye. The tears, the oil glands, the eyelids, the cornea, the conjunctiva, the nerves. Many of my patients are told their eyes look fine, yet they are completely miserable. Dry eye isn't a minor annoyance. It's not something patients are imagining. If you've been told it's just dry eye or you'll have to live with it, I want you to know there are explanations and there are better approaches. In the next videos that follow, I'll explain how I evaluate dry eye, why symptoms don't always match exams, and why treatment must be layered and personalized. In the next video, I'll explain why the term dry eye can be misleading, and why understanding what's really happening on the surface of the eye is key to getting better.